Hello, this is for the HE Health Information Network, and welcome to our AHIN Hour, our bi-monthly webinar series where we feature topics on e-health, health information systems, and information technology for civil registration and civil statistics. Tonight we'll learn how professionals like Norma Sarkar use technology in teaching community health nursing with global partners utilizing videoconferencing as a knowledge gateway. For research platform, how to participate, and email feedback. We're using Cisco WebEx Event Center. If you're encountering problems in joining, log out the session and rejoin immediately. Our meeting room number is 868-366-918. The password is Michigan123. Your mic will be muted in this meeting, but you can send your thoughts to us by clicking the chat icon. For questions, click the Q&A tab and key in your queries. After joining, you will receive an evaluation form. Kindly answer it so we can send the slides and other resources of this meeting to you. Our speaker for tonight is Ms. Norma Sarkar, who graduated from the University of Michigan, where she earned her nursing degree and master's in public health. From 2002, she has been teaching community health to undergraduates and second career. She is also currently providing instruction at several sites. Norma guides students in the delivery of maternal-child health care in the home, familiarizes them with community resources, and provides opportunities to work with various aggregate populations, including the homeless community in Washtenaw County and middle school students through the Regional Alliance for Healthy Schools. She also gives clinical instruction focusing on active aging in Washtenaw County. Norma has developed a global health focus for the community health nursing course over the past 3 years. This includes providing students with immersion experiences in other countries, utilizing videoconferencing to connect with schools of nursing in other parts of the world, and focusing on vulnerable populations for local clinical experiences. Without further ado, let's welcome Ms. Norma Sarkar.
Good morning. I'm pleased to be with you today and to talk about what we have done to give a global focus to our course. So let me pull up the screen. Okay. All right, I believe we are ready. So today we're going to talk about the objectives are to discuss how we have internationalized our community health nursing curriculum using technology, and specifically talking about our global partners in Haiti and in India. The three technologies I'm going to talk about are video conferencing, utilizing BlueJeans software, the use of the Knowledge Gateway, which is an electronic Blackboard app, and blogging. The other thing is I will talk a little bit about our preliminary evaluation findings and share some lessons learned from our experiences. The definition on which we operate for our course is the World Health definition that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. The objectives of the course are to expose our students to nurse roles in various community settings, to focus on population health rather than just individual level health, and to demonstrate to them the community as a context for health promotion and care. Our course is structured to have a large lecture and 8 to 10 clinical sections. And those clinical sections have 1 instructor and 8 students. And in those clinical sections, the focus is on practice in a community setting. So it has become very apparent that we live in a very global world. All nurses encounter a variety of cultures and beliefs wherever they practice. This is really true in the United States, where there are a diverse populations throughout the U.S. And we also know that immigration, travel, and technology have allowed all parts of the globe to touch each other. So it's very important that we give our students this global focus. There are some common themes that link global health to community health very strongly. One is community assessment. We teach our students how to assess a community and what kind of impact that has on the community's health. We talk a lot about population health. What are vulnerable populations and what are and social determinants and health disparities. So this is the U.S. Depiction of social determinants of health. But social determinants of health is a World Health Organization concept. And the World Health Organization describes it as the circumstances in which people are born, grow up, live, work, and age, and the systems put in place to deal with illness. And these circumstances are shaped by a wider set of forces, including economics, social policies, and politics. So you can see from the diagram here that it has been broken into the following categories: education, economic stability, neighborhood and built environment, health and health care, and social and community context. So this is the framework that we use with our global partners to discuss community assessment. Our goals for our community health nursing students include cultural competence, understanding population health from a global perspective, learning to use community assessment and analysis with the social determinants of health, and developing strong global community partnerships. Our strategy is a three-pronged strategy. In the community health nursing course, you may experience this global focus through immersion, where you actually spend some time doing clinical work in another country, or through video conferencing, where you may video conference with another school in another country, or what we global, where you look at vulnerable populations within your own community. So our immersion experiences include an experience in Quito, Ecuador, where students work in the Ministry of Health clinics there for about 2.5 weeks to gain an understanding of healthcare delivery in Ecuador. Our other immersion experience is in New Delhi, India, and our partner is the Salokia College of Nursing. And the clinical experiences include government hospital outpatient departments as well as regional health clinics. And the Ecuador group just returned from their time in Ecuador, and I will be leading a group to New Delhi in the month of August. Now, not everyone can travel to do an immersion experience, so video conferencing provides another way for students to accomplish the learning goals without the travel. And it also lets us expand our global health opportunities to a larger population of students. The video conferencing technology that we use is BlueJeans. It is a software that has been obtained by the University of Michigan, and it enhances teaching for U of M faculty and our partners. Excuse me. So in order to use BlueJeans, it simply requires that you have a strong internet connection. It does work well with low bandwidth countries. It allows you to record your sessions, and it provides some technical analysis of the quality of your transmission. So your global partner needs a stable internet connection to join the meeting. You need for individuals, you just need a computer with a camera and a microphone. For small groups, you need a video cam and a microphone so you can capture the sound in the classroom setting. But it does not take a large amount of funding to obtain this equipment. So our plan was that we would schedule 8 two-hour video conferences with our partners. One of our partners is in Haiti, and the other partner is in New Delhi, India. And both groups of students would be doing a step-by-step community assessment using social determinants of health. The students exchange their assignments prior to the video conferencing session so that the session may be used for discussion. And we utilize the Knowledge Gateway, which is provided by the World Health Organization, for sharing of information. So this gives you an idea of what does the Knowledge Gateway look like. It is the Knowledge Gateway, as I said, is funded by the World Health Organization. It supports over 300,000 health and development specialists across the globe in various electronic communities. So you may join the Knowledge Gateway and create a private community for faculty and student knowledge exchange between global partners. The Knowledge Gateway allows you to download documents and share information prior to your video conferencing sessions, exchange ideas, and you can also archive the materials that you're using. Our librarians from the Topman Health Sciences Library created a health research guide and also provided access to open source materials for our global partners, which is really important to distribute knowledge in low resource areas. This is a picture of one of our video conferencing sessions. My students are seated at the tables, and if you look on the screen, you will see the classroom in Haiti and the students that we are working with. We have video conference with Haiti for the past 3 years in the fall term, and we are planning to do that again this fall. These are our global partners in New Delhi, India, and we have worked with them for the past 2 years. We also have developed a relationship with the University of Botswana College of Nursing. And the third leg, we talked about immersion and video conferencing. The third leg of our strategies is local, and that means to think globally and act locally. And that was coined by a person named Rene Dubois in 1972. And what it talks about is that the global environment can be improved by action at the local level, and it requires that you assess the local context, ecology, and cultures in the area to determine appropriate intervention. So this focus on cultural exchanges with local communities has been very useful. As I mentioned, we have a lot of diversity, especially in Ann Arbor, which is a university community with students and faculty from many different countries. There are important issues that can be looked at, including immigration, the impact of languages, the various health beliefs, issues around social and environmental justice for recent immigrants as well as those who are long-term. You can also look at cultural differences in health practices as well. So global is a very important part of ours. And this is an example. We have a senior community which has a large number of Chinese residents. And our students worked with that particular community in a global way. So another strategy that we use to unify the work of all of our sections is the world-class blog. And the community assessment model that we use is the community as partner model by Anderson and McFarland. So this is what our course looked like prior to our efforts to globalize. We had a lecture that disseminated information out to the various sections, clinical instructors and their sections of 8 students. But with the blog, what we were able to do is include our video conference partner as one of our circles. You can see on the map, section 10. And the blog allows each clinical group to communicate with the other. And that was the important piece that we wanted to add so that we could share our video conferencing information with other students in the course. So this is a picture of the blog, and it is a private blog. It is only accessed by those who are invited to be there. And the purpose is to allow each clinical section to address a question each week about their community, the progress of their community assessment. And then the next week, they will answer a question which asks them to look at the contributions by each clinical section and compare and contrast the information. And that compare and contrast includes our international partner. This is a table that we generated for each area where we looked at some very basic demographic information: population, geographic size, gender ratio, racial distribution. We also included infant mortality rate. So just some basic data to begin to understand these different communities. Most of these communities are in southeastern Michigan. We usually only have one international partner per semester, but we include the international partner in this sharing. So we feel like the blog was a really important piece to include in the process. It gives the students practice in comparing and contrasting various communities. It allows them to look at health disparities in their own communities, and with including our international video conferencing partner, it also begins to let them look at global health. So this is a quote from one of the blogs, and it says, the most striking comparison between two communities for our group was that 80% of the population of Haiti is below the poverty level, whereas Ypsilanti is listed at 26.4% below the poverty level. Ypsilanti is also the highest percentage of people below the poverty line of the communities that are class researched. So Ypsilanti is a community in Michigan, which is adjacent to Ann Arbor, and then of course Haiti was our international partner. The other important thing was using the social determinants of health. We could focus on what were the social determinants that were causing these health problems or disparities in social determinants. And focusing on the cause takes away from maybe the great differences in amount. So it wasn't really the amount of difference, but rather what was the social determinant that was responsible. So maybe it was economics, maybe it was education, and those social determinants apply to the challenges we have here in the U.S. as well as in other countries. So that is why we chose to use the social determinants of health. It kind of levels out the playing field, and you begin looking at cause rather than just race. Okay, so what do we think was the impact? And For faculty, it certainly strengthened the community assessment process. As faculty, we were using the same tool. We were comparing notes with each other more often, and so it really strengthened our teaching approach. Remember, I said there were 10 clinical sections. So what we found is when you're all doing the same thing and communicating with each other, it just gives you a better product. Also, the use of the global emphasis highlighted the importance of vulnerable populations, not only globally but right in our own communities. And it increased interest among other faculty in global health projects. So we started with one video conferencing site. Now we have 3, and next year we may have possibly 4. So other faculty have become interested in being involved in video conferencing. For our students, they certainly realized that resources impact access to data. As they were doing their community assessment, they communicated with their global partners and found out that some countries have more resources to assess their populations than others. So they realized just how many resources they had available to them. The knowledge of differences in nursing practice based on resources available was something that was very interesting to them. For example, the limited number of physicians in Haiti makes it necessary for nurses in Haiti to be trained and to do delivery of babies, even in the undergraduate program. So it's not having a master's in midwifery, but as part of your undergraduate program, you learn to deliver babies. So the U.S. students were very surprised to learn that that was a part of nursing practice, but also understood why that was necessary. And finally, our students had an increased awareness of global health issues and cultures, specifically learning about other health practices and beliefs based on that particular population and their religious beliefs or values. These are some comments from our U of M students after the video conferencing sessions. And FSIL is the name of the school in Haiti with which we worked. So these are some of their comments, that the FSIL students provided valuable insight into their lives and their culture. The most valuable was learning about the students and their personal experiences, and this could not be obtained via the internet. And in this highly technological world, it was gratifying to me to find out that the students really gained from the face-to-face interaction. It wasn't something that they could just look up on the internet. Understanding how they felt about issues facing their country, getting a personal opinion about healthcare in Haiti was useful. So talking to nursing students, comparing clinical practice, using case studies, gave them a very clear view of what was happening in healthcare in Haiti. And finally, the experience of obtaining a global health perspective without leaving campus. Again, providing a global experience to students who may not be able to afford an immersion experience or may not desire that kind of travel. These are some quotes from our students in Haiti about the process, and it says, "I think you must continue with this exchange between the young people of these two communities. This video conference helped me to enrich my vocabulary and to see what I have in common with other young people and what differentiates us." The language of instruction at the school in Haiti is French. The students also learn English, but French is their language of instruction. So there is extra challenge as they listen to and work through the information in English. Another student wrote, "It was a good thing for students. I liked the emphasis was placed equally on culture in the community." So we were very careful to make sure that both groups of students shared information as equally as possible. And these are some comments from the students, U of M students who worked with the India group. And the U of M student talked about the most valuable was learning about community in a global context. It was extremely helpful to my global perspective to compare and contrast two different communities across the world from each other, realizing there are many similarities and interesting differences. And from a student in India, through the video conferencing session, I gained a lot of confidence in speaking English. It was the first experience for me to attend these types of conference. So the language challenge in India is different. The students know English, but they have had varying levels of experience in actually speaking English. So the video conferencing was a chance for them to actually utilize their English language skills. Evaluation. Overall, the knowledge of differences in nursing practice based on resource availability was something that numerous students talked about. The students at U of M, in their evaluations, often spoke about the increased awareness of culture. The students in Haiti talked about the differences in disease burden and healthcare delivery. The students in India valued gaining more knowledge and gaining confidence in their ability to communicate with the school in the U.S. Overall, we were very pleased. We felt like the different technologies really helped us to build a bridge with our global partners, and that everyone benefited. The saying, "all ships rise with the tide," that our students benefited from the exposure to other schools. Other schools were able to, with a minimum amount of equipment investment, were able to connect with us and establish a global experience that they may not have otherwise had. Lessons learned in terms of video conferencing. Connectivity really matters. If you don't have a good connection, your experience is not going to be as positive as you would like. There are some unique challenges in low resource areas. So if you're going to connect with a global partner, you really need to assess carefully what are their resources and what might be some issues with connectivity. Certainly time differences and different academic calendars are something that partners need to work through, but it's not impossible. I spoke a little bit before about the language challenges. Our students in Haiti were conducting video conferencing in a second language. Our students in India knew English but had not had a chance to actually speak it. Cultural and practice differences. I told you the story about students in Haiti who deliver babies, and the typical reaction from the U.S. students was, "You do what?" So understanding the differences in practice. Also understanding the different kinds of medicine. In Haiti, voodoo is a very important part of their culture, and clients may seek a voodoo doctor before they seek a Western doctor. In India, there are other forms of medicine. There are homeopathic medicine, there's Ayurvedic medicine. So there's not just one single form of medicine practice, and clients may be using more than one. The Knowledge Gateway was extremely helpful because we could exchange documents and then everyone could go to the same repository to access them. We were able to upload the library guides and open source materials And so we provided library services that other colleges may not have, because we do have a lot of resources at the university, and so we wanted to share whatever we could to help our partners. We find our global partners were very amenable to verbal exchange. The use of the blog was something very different, and it took a while for them to become somewhat comfortable with that strategy. It was just a different style or a different strategy than they'd used before. We also, the schools that we worked with are very good, but we encountered a more traditional teaching style, more delivery of information. So the interactivity of our course, the blogging, and the use of the Knowledge Gateway were something different for our partners, not something that they didn't want to do, but just something different. And it was just interesting to me that we all teach well, but we teach with different styles. So our next steps are to continue to strengthen our global partnerships. We will be continuing our video conferencing work with Haiti in the fall and with India in the winter semester of the academic year. And we are hoping to expand our efforts to other schools. We have some other schools that we have spoken with, again, looking at these issues of timeline, academic calendar, connectivity, making sure that we can have a successful experience. We are currently working on strengthening the evaluation of our global health efforts and trying to look at how might we measure an increase in cultural awareness or cultural competence. There are a number of terms now being used. But we would like to look at what kind of difference is it making with our students. And finally, I think it has encouraged us as a school to look at encouraging second language development and providing opportunities. In the past, our nursing curriculum was so full and so structured that language classes were pretty difficult to move into that curriculum, but we've kind of taken a new attitude in terms of trying to give our students opportunities to pursue more language than they might have done in the past. So technology has allowed us to reach around the globe with our students and expand their awareness of culture and global health issues, and it has truly provided a new vision of our world through a global lens. This is Dean Hilda Elsindor, is the Dean at the Faculty of Nursing Science of the Episcopal University of Haiti in Leogane, Haiti, and they are our partners there. Our partners in India are the Salokia College of Nursing in New Delhi, and this is a picture of us visiting last year in preparation for taking students this year, and this is their faculty and us. And this is the University of Botswana College of Nursing in Gaborone, Botswana, and Dr. Natabi Baldaz is the person that we are working with, our partner there. We have some local community partners, the University of Michigan Health System, Department of Community Programs and Services, and our library is the Taubman Health Sciences Library, and our global health librarian has been very helpful. Okay, so that is my presentation. I would be happy to take questions from the group or clarify or provide more information about any of the topics I discussed.
All right, thank you for that wonderful lecture, Ms. Norma. So for all of our attendees, we will now start answering your questions, so you can start sending them in. Thank you. Ms. Norma, I have a question.
Yes.
You have a curriculum for this webinars that you're having, right?
I'm sorry? Say that
Do you
again?
have a curriculum? Do you have a curriculum for this webinars that you're having with other countries?
Yes, it's a curriculum that we developed. It is based on conducting a community assessment by each group of students and then sharing that information each week. And we base it on the community assessment, and we utilize the social determinants of health for our discussion questions. So it's kind of a curriculum that we developed. I mean, we use other people's tools, but we kind of put it together.
So you get inputs from other countries first before planning it? Or
Yes.
you... Oh, all right. Okay,
so we work
you.
with our global partners, and before the semester begins, we work out a calendar of topics that we will discuss each week. And we usually, we use the social determinants of health. We use the information that the students gather through their community assessment. And we often specifically focus on a health issue of interest. For instance, we have looked at childhood malnutrition. So one week we might talk about education. And so each group of students would formulate a short report on how much education is there, is primary education paid for, what are your education opportunities, what is the literacy rate of the country, and then we might look at how, given the educational levels of your population, how might that impact childhood malnutrition. So that allows the students to bring that information back to a health issue.
All right, Ms. Norma, thank you for that wonderful answer. We have another question. It says, community assessment is only covered with this subject. Is there another CHN subject that tackles implementation of health programs based on the results in the community assessment?
I'm sorry, would you repeat that one more time?
All right, so it reads, community assessment is only covered with this subject. Is there another CHN subject that tackles implementation of health programs based on the results in the community assessment?
In our own curriculum at U of M, the students analyze their assessment and identify an appropriate intervention. Our experience with our global partners so far has been that we have not had enough time to move past like analysis of the information to use a community nursing diagnosis and an intervention. Our video conferencing time is 8 to 10 sessions, and that seems like a lot of time, but it really isn't in terms of trying to get through all the material. So we do, our own students at U of M do intervention, but we have not been able to include that in our curriculum for video conferencing just due to time constraints.
All right, thank you. We have another question, Ms. Norma.
Yes.
And it reads, as per your experiences, do you find any difficulties on effective communication in practical sessions other than internet and language barrier, like in terms of giving on-care assessment of disease or conditions?
Okay. Can you repeat the question one more time?
All right. As per your experiences, do you find any difficulties to ineffective communication on practical sessions other than internet and language barrier, like in terms of giving examples on care, assessment of disease or conditions?
Okay, so the one commonality that we often find with our global partner is their understanding of health conditions and nursing care. And those seem to be very similar. So that gives us, a common basis for discussion. We may talk about how that condition is managed in different countries, but that knowledge of nursing is a really important commonality. Our biggest challenges, like I said, have been with the fact that with one global partner, we're working in their second language. Well, really, with both global partners, we're working with their second language, but the students in India have had more classroom instruction in English, even in their primary, secondary schooling, as opposed to the students in Haiti, where English has been taught to them when they arrive at nursing school. So they have a not as strong of a base in English. But those have been the big problems. In terms of understanding concepts, that doesn't seem to be as much of an issue. We just have to get through the language barriers.
All right, thank you, Ms. Norma. So another question, you have a curriculum that you have. Is this like something that schools have? Like, is this like a formal class that runs from 8 to 10 sessions? Like, are there levels that students have to pass?
Yes, okay. So this video conferencing experience focuses heavily on the community assessment piece of our curriculum. The students are 4th level students, and this is a required course called Community Health Nursing. Not all of the clinical sections are involved in video conferencing, but every clinical section has to do a community assessment. So this is the video conferencing experience is just a portion of our curriculum. The students have lectures and exams that cover a wider variety of topics, but we focused in only on the community assessment for this video conferencing portion. So if I can be clear, the community assessment is required of all students. It's just if you are in a section that is video conferencing, then you get to share that information with other clinical sections and your global partner. So the whole course is community health nursing, and this just focuses on a portion of that. We don't actually try to teach the whole course to our students and our global partners. Again, it's a matter of time available. So I would describe the video conferencing as an enhanced clinical section where you complete the community assessment like all other sections, but you have the opportunity to share it with a global partner.
All right, thank you, Ms. Norma. So for another question, it reads, with the differences you saw in the nursing practice in each country you've worked with, how do you plan to use video conferencing in developing a standardized community health nursing practice for the general nursing profession?
Oh my goodness. That's a very large question. I I think, you know, the level of nursing practice is dictated by the resources of the country. So although for community health, there are certainly some similar concepts that we could agree upon, I think each country adds the pieces depending on what their particular needs are. So, so I think, you know, community health nursing in the U.S. certainly looks a lot different than community health nursing in Haiti, just because of the resources, and even community health nursing in India. I think, in my opinion, the U.S. could use more community health nursing than we have. I think we've been a little too acute focused, but I think there are some general principles that everyone could agree on, but I think it needs to be individualized to the resources of the country. Good question.
All right, thank you. So for another question, Ms. Norma, you share all the learnings you have in this curriculum through blogs, right, and the knowledge management. How do you share it to other nurses, like those not participating in this video conferencing that you have?
Within our course? Within our course,
yes.
we use the blog. So each clinical section, there's a series of questions that are posted on the blog, and each clinical group, all 10 groups, answer those questions each week. And then the next week is a response. So all of the students read what has been posted. So there are 10 groups, so there will be 10 postings. So they read those 10 postings, and a question is posed to compare and contrast or something like that. So then, based on what they have read from the other sections, they post a response. So it's a read and response structure that we use. And that's the way that each clinical group knows what the other clinical groups are doing. And that's important because even in the southeast corner of Michigan, we have clinical groups in different cities, and the communities are very different in terms of their economic level, their level of education. We have very rich communities, not so rich communities, and students don't always know that, you know, that those kinds of differences exist. So the blog has really helped us to allow all of the clinical groups to communicate with each other in an organized fashion.
Just a follow-up question. So it's only available for those in your network. Is that right? Or you also share it to the outside world, like all the learnings?
We are in the process of publishing some articles on our experience. The materials on the Knowledge Gateway are in a private classroom, as they call it. So, but we are in the process. We have one article finished and another one on the way. So we're trying to publish our work in that way.
All right, thank you. How about the assessments? So this is just like a part of the whole curriculum for a class, right? Do you have exams to see, or do you have to like have practical sessions to see if they learned what you're saying in the video conferencing?
Okay, so the community assessment they actually have to complete, we've developed, based on the Anderson-McFarland model, we've developed a form that they complete as a group, and that is a graded piece of work. So it's part of their grade. The lecture portion of the class has 3 exams, and so those exams look at their conceptual understanding. And then in the clinical sections, we do more practical pieces. But one of those is that they complete the community assessment, and they are required to find the 5 strengths in that community, 5 weaknesses in that community, formulate a community nursing diagnosis, and a realistic intervention and a plan for evaluation. So in the clinical group, it's a group project, they actually go through all of those steps, and it is a graded project.
All right, thank you, Ms. Norma. We have another question here. It reads, based on your experiences as a community health nursing professor, what do you think will produce better learning outcomes? The traditional teaching or teaching with access to knowledge gateway?
Well, I think you can be successful either way. We were just very interested in giving our course a more global perspective. So that is what prompted us to do the video conferencing and create the Knowledge Gateway and the blog. So I mean, I think you can do it either way. Whatever way you teach, I think you can incorporate, more global concepts into your teaching. So I don't think one way or the other is better. That anyone can join the Knowledge Gateway, and it does have a lot of public information. Because we were dealing with students, we were concerned about opening it up to the public. We felt like we needed to keep it private at that point because the students were actually contributing information to it. But the Knowledge Gateway has a large amount of public information, PowerPoints, chat rooms around various topics. So I would encourage your participants to you simply go to www.knowledgegateway.org, and for no fee you can join, and then you can explore what is of interest to you. So it's something that's open to everyone.
All right, thank you, Ms. Norma. I have another question. I'm just curious of the costs of this video conferencing, because you do it globally. So are there payments that they have to do, or it's just literally a partnership?
Okay.
And then you do it for free?
No, the Blue Jeans software that we use, there is a cost, but it has been purchased by our university. So there was not a direct, the cost of Blue Jeans is spread across the entire university, and all faculty have access to it. So, so that is a cost that we personally did not have to absorb. It's a benefit of being part of the university. So, and other universities use it as well. So, but there are other softwares as well. That just happens to be the one that we use. We did get a small grant to purchase the equipment for one of our global partners. The camera was around $250, And then for a small group, you need a microphone, which is about another 100 to 150. So the actual equipment that you need in the classroom, you can probably purchase for about $500 US. And we obtained a small grant to do that. The biggest costs are in your time, your commitment to the project. But our global both of our global partners were able to make the camera and microphone investment. So it's not a large investment. Like I said, the other investment is that you need an IT person that can just help you get connected and problem solve any connectivity issues that you run into. And that's handled by our IT department in our School of Nursing. So like I said, the biggest costs are you need some equipment, you need time to work with your global partner and plan all of this out. And if you're in a university setting, many universities now have some kind of software that that allows this kinds of video conferencing. So there are many that you can use, many different ones that you can use. For instance, you use Cisco, we use BlueJeans. There are different ones available.
All right, thank you so much for entertaining our questions, Ms. Norma. All right, so are there any questions left? All right, so we have another one here. I guess it's going to be the last question for tonight. It reads, with the various nursing practice in different countries, what do you think should be pursued further in the future of the nursing profession, given this reaching out for a more global nursing through video conferencing?
Well, I certainly think that our students benefit from understanding what nursing practice looks like in other countries. So I think that's important just for them to understand that and nursing is certainly an important health profession. And what does it look like in your country? What does it look like in other countries? They also see that nursing is important here in the U.S., but in countries where there are very limited numbers of physicians, it is even more important because there are, a limited number of healthcare professionals. So I just think it gives them a better understanding of nursing practice. It certainly reaffirms that there is a place for nursing in healthcare all over the world, and so I think that's important for all of us to know. And nursing is at very different places in different countries. In India, they are working their way up to a bachelor's level, and nursing is a more highly regarded profession than it used to be. In Haiti, nurses are very important because of the lack of healthcare practitioners available. They have an important role to play. And, those are the ones that I'm most familiar with. I think video conferencing just gives an opportunity for us to learn more about each other. And I think that has great merit.
All right, thank you so much for that answer, Ms. Norma. So that is the last question for tonight. Guess we'll have to end here since it's already time. Thank you, Ms. Norma, for being with us tonight, as well as our participants, especially those who actively participated. May we remind everyone to check their emails for the follow-up message we'll be sending. Please answer the feedback form so we can access this webinar, and so we can send out the other resources of the session to you. Okay, so thank you everyone for attending. This ends our webinar for tonight. Thank you for the wonderful session, Ms. Norma.
Thank you very much. I want to thank all the participants. I'm glad that I was able to speak with you, and I believe Ms. Cha has my email address. So if participants have further questions, feel free to contact me by email.
Yes, thank you so much, Ms. Norma. Thank you, everyone. This has been Cherise of AHIN. Good night. Good morning, Ms. Norma.
Bye.
Bye.
Bye. Thank you.